If it's your great, if it's your first time with us, we'd love to meet you. Today's didactic is by our very own Dr. Trang Lee, who is a PharmD at Overlake Senior Health. And she's going to speak to us about a really important topic that I'm sure I can imagine many of you all encounter not infrequently, which is brain health supplements. And she has very graciously embedded case vignettes. So I can imagine a lively conversation and discussion, and you guys get to share what has worked well for you. And there's so much that you all know. So please rename yourselves first and last in the clinic that you're joining from. Please mute the microphone when you're not speaking and say your name when you're on unmute. Turn on the video if you can. If there's more than one of you in the room, then let us know by putting all the names in the chat. For attendance and CME credit, for those who are affiliated with the University of Washington, then you are required to complete a mobile text registration and sign in. If you haven't registered yet, here's how to do it. You'll get a response. And then after registration, you want to text this new number, which is 13461. It'll be the same number going forward, but it's different from previous numbers since we have a new CME. We just re-completed CME. You should receive a response stating thank you, John Doe, etc. So thank you for doing that. Don't worry if you're not affiliated with the University of Washington, all other attendees, your attendance is being tracked and recorded by the program manager and also by Zoom Analytics. So that's why we need you to display your full name. And Sarah McKitty is going to reach out to you if she needs additional information. So there's 1.25 credits per session of CME through the University of Washington if you participate in this live. All of the sessions are recorded, so if you couldn't make it, you can watch it later, but then unfortunately you wouldn't get CME. And none of the planners have relevant financial relationships to disclose. There are a number of additional fantastic programs that are CME accredited as well, including University of Washington Project Echo Geriatrics on the third Friday of each month, the Traumatic Brain Injury Behavioral Health Echo, the Psychiatry and Addictions Echo, and a telebehavioral health training series. There's also a telephone consultation through the University of Washington Pain and Opioid Provider Consultation Hotline, and a telepain series that's CME accredited. And then there's archives in psychiatry and neurology. You can attend via Zoom or watch through the archive. And as always, please consider bringing a case presentation to our community. We're here to help prepare that presentation if that would be useful to you. As we always say, there's no case that's too simple or too, complicated. We're here to kind of think together and to come up with a plan together. Reminders that we really are we're of course HIPAA compliant. We protect patient health information, so don't share any information that could reveal any identity. And as I said earlier, all sessions are recording and available on our website. Please complete the 1-minute post-session survey. Here's our hub team, which, as you see, is really across many health systems and the Dementia Action Collaborative, and also many disciplines and perspectives. And here you all are, and we've provided over 2,000 instructional hours since the beginning in June of 2020. And in 2024, 100% of the respondents reported that Project Echo Dementia improved their quality of care for patients with dementia. and nearly 64% reported changes by others within their organization based on participation in Project Echo, which is really inspiring. So please do share with your colleagues who you think might benefit and enjoy participating. Currently, we've got 96 sites with 250 zip codes and 278 providers. And if you want to join, you could just reach out to Sarah. And without further ado, we are so fortunate to have Dr. Trang Lee, who is a PharmD with Overlake Senior Health, speak to us today about brain health supplements. And I asked Sarah to also put in the chat. She gave two fantastic other talks um, about medications and the Beers criteria and other really useful information. So if you didn't see those, I would strongly encourage you to look back at those. And for today, thank you, Trang. I'm going to stop my share and take it away.
Thank you, Nancy. So let me see. I'm going to share my screen. Are you able to see the first slide? It says brain health supplements.
Yes.
Yes,
It's just
thank
not in
you.
presenter mode yet.
Okay, I'm going to do presenter mode now. Okay, it is now, right?
Yes.
Thank you very much. Thank you, everyone, for coming today. Today, I'm going to talk about brain health supplements. As we all know, many supplements are promoted with claims for a wide range of conditions. So since this is a project Echo Dementia, I will focus on the evidence related to cognitive decline, mild cognitive impairment, and Alzheimer's disease. I have no financial relationship to disclose. And today's learning objectives are to identify prevalence trends in supplement use in older adults. We're going to explain regulatory oversight. We will interpret safety and efficacy data for common brain supplements used in older adults. We will discuss safety concerns, and then we will identify supplement-related concerns through a patient's case. So dietary supplements include vitamins, herbals, minerals, botanicals, amino acids, and also enzymes and probiotic. Under the 1994 Dietary Supplement Health and Education Act called DSHA, under this act, clinical trials are not required. Therefore, efficacy does not to be demonstrated. The manufacturers of the supplements can only make general claims to a well-being, function, or healthcare, such as promoting prostate health or supports circulatory system, provided with a disclaimer that this statement has not been evaluated by the FDA and this product is not intended to diagnose, to treat, to cure, or to prevent any disease. So in 2007, the FDA required the new Good Manufacturing Practices, or called GMP, dietary supplements under the new FDA rules are required to be properly labeled, free from adulteration, meaning free from contamination, and manufactured in accordance to the specific standards. And there are many independent organizations offer quality testing to verify good manufacturing practices that I met. However, they put on the seals. It doesn't mean that the product is safe, effective. It just means the product is properly labeled and also it was manufactured in a clean, sanitary environment. But it does not guarantee safety or efficacy, any safety or efficacy. In fact, between 2010 to 2013, 70% of the FDA's inspections resulted in citations for failing to follow the new GMP standards. So that's about 7 citations per company by the FDA. So in 2021 survey by ARMP, 1 in 5 adults 50 years and older take a dietary supplement for brain health. And the top reasons were that they want to take because they think they want to take it because they want to maintain and improve memory. And also they want to take it because they want to maintain and improve mental sharpness. And also some take it and they think they can delay dementia. And that translates to a lot of medication, a lot of money spent in supplements, about 9.6 billion this year in 2025, and that is projected to grow to almost 21 billion in 2033 in regard to supplement sales. So today we're going to talk about lots of supplements. So I'm going to go through all these supplements, and these are just common supplements that we do get questions from our patients. So the first one is Prevagen. Let's see. Yeah. First one is Prevagen. Prevagen has an active ingredients called apocorin. It is a small protein consisting of almost 200 amino acids residues, and that is isolated from jellyfish. And when this apocorin is bound with calcium, it illuminates, giving the jellyfish the blue glow color that we see. The mechanism of apocorin is that it has a structure that is similar to human calcium binding proteins. Some researchers think that apocorin can help regulate calcium homeostasis, and therefore it might slow down the progression of age-related memory and cognitive decline. The dosage is 10 milligrams daily up to 90 days because that's what was done in the study. Side effects include headache, hypertension, chest pain, and irregular heart rate. So the study for Prevagen included about 200 adults aged ranging from 49 to 91 years old with self-reported memory problem. The patients did not have dementia. They enrolled the patient to get 10 milligrams of apocorin, compare that to placebo, and the duration of the study was 90 days. The outcome measures they used was the verbal learning assessed by Ray Auditory Verbal Learning Test. So they used this test to measure the outcome. And the result turned out to be that there was no difference uh, uh, between the placebo group and the treatment group. Also, they look at the secondary outcomes, looking at mood, sleep, anxiety, executive function. Again, there was no consistent significant changes in mood, sleep, and executive function. Interestingly, apocrine is rapidly broken down in the digestive tract. About 90% of it digested in less than 30 seconds. Because it's digested so quickly, so very little of it would be reaching the brain or the bloodstream of the brain, so making it very unlikely to have any direct therapeutic effect. And also, the FDA has sent the warning letters to the maker of Prevagen, which is Quincy Bioscience. Originally, apocorin was extracted from the jellyfish. Because it was extracted from the jellyfish, it's considered a supplement. Now the company is extracting apocorin from E. coli. Therefore, that is classified as a drug instead of supplement. So when it is classified as a drug, it needs to go through all the formal FDA review for efficacy and safety. So therefore, the FDA has sent a warning letter to Quincy Bioscience stating that it is selling an approved drug, it has illegal claims, it has lack of FDA-approved clinical trials, it failed to report adverse events, and also it is non-compliant to good manufacturing practices. The next one we're going to talk about is Nuviva. Nuviva has 2 active ingredients, the whole coffee cherry extract, which is the coffee fruit, and also phosphatidylserine, which is a precursor of phospholipid. So the mechanism of action is that phospholipids are thought to repair the plasma membrane and improve neurons functions in the brain. And then the dose is 300 milligrams daily for up to 6 months. Lots of GI side effects and also headache, insomnia, and I probably think because of the coffee beans, and nausea. The study for nausea involved about 100 patients. Usually, you notice a lot of these studies are smaller. They have small number of participants. This study enrolled younger patients up to 65, so between 40 to 65 years of age with self-reported memory problems. They enrolled patients to get Nuviva or placebo. They used a variety of outcome measures, including some mental performance tests. The result turned out to be that there was no significant differences in a lot of these mental performance tests, except for one. It's called Compass, and there was some improvement in the Compass at day 22 for Noriva compared to the placebo. However, the limitations of the study was that it only evaluated for 42 days. That's 6 weeks. So that's really we cannot use that conclusion for a general or bigger patient population. The next one is turmeric. You have heard of turmeric or curcumin. Curcumin is an active compound found in turmeric. So a lot of the studies was done using curcumin. So this study enrolled patients with Alzheimer's disease, very small study, 34 patients with mild to moderate Alzheimer's disease. They gave the patient curcumin either 1 gram a day or 4 grams a day, and the study was for 6 months. Compare that to placebo. And the outcomes turned out to be that there was no significant difference between curcumin, either at 1 gram or 4 grams, compared to placebo, according to the MMSE and also the ADAS-Cog result. This study also may measure the biomarker, and it turns out the plasma biomarker did not differ between the treatment groups and the placebo groups. Lots of GI side effects with turmeric. The next one is caprylic acid combined with coconut oil under the brand name called Oxana. This is considered a medical food because it contains medium chain triglycerides. It is thought that medium chain triglycerides are thought to be metabolized to ketone bodies, and that serves as a source of energy for the neurons. The dosing is that it comes in a powder, it's 1 package a day. Side effects, of course, increase in triglycerides, GI discomfort, and also weight gain. The study for Oxana enrolled 152 adults with mild to moderate Alzheimer's disease. They gave the patient Oxana, compare that to placebo, and they look at the ADAS-Cog. So the finding was that in mild to moderate Alzheimer's disease, Oxana showed modest but inconsistent improvements in cognitive scores. However, they found that the patients with the ApoE negative, ApoE4 negative patients, they have slightly better response. But overall, the evidence seems to be limited, and larger and longer clinical trials are needed to determine the benefit of Oxana. Next is coenzyme Q10. This is a systematic review looking at adults for cognitive decline. They gave the patient CoQ10, compared that to placebo. This study actually measured the CoQ10 serum concentration, and they found out that CoQ10 concentration was similar in both the intervention group and the placebo group, suggesting that there is no association between the CoQ10 level and the cognitive function or cognitive decline. Next is core calcium. Core calcium is chemically almost identical as calcium carbonate, which is Tums. The dosage is 5 milligrams a day, lots of GI side effects, including belching and gas, nausea, and diarrhea. And look at the cost, $40 to $70 per month compared to a standard calcium supplement. So at this point, there are no published clinical trials evaluating core calcium for the treatment or prevention of dementia or even for cognitive decline. And there are no major reviewed clinical trials to show that core calcium provides any additional health benefits over just the standard calcium plus supplements. In fact, the FDA has sent a warning letter to the manufacturer for misleading claims, particularly relating to the cancer prevention and treatment. So as of now, calcium core calcium has no additional benefits compared to either calcium citrate or calcium carbonate. The next one is omega-3 fatty acid. So this is a Cochrane review looking at 3 randomized clinical trials. Of course, because there are 3 trials, so there are bigger or more number of participants, 3,500 older adults without dementia or adults with MCI. The intervention group received omega-3 fatty acids, compared that to placebo. They looked at the MMSE test score, and it shows that there's no meaningful differences between omega-3 group and placebo group. And then also omega-3 supplementation in older adults did not prevent cognitive decline or dementia over 3 years follow-up, because this is a 3-year follow-up. Lots of GI side effects and also fishy aftertaste. The next one is tremiprosate or homotaurine. Tremiprosate is thought to work by binding to soluble amyloid beta. Therefore, it might prevent its aggregation and therefore might prevent the plaque formation. So the study for tremiprosate involved patients with mild to moderate Alzheimer's disease, about 1,000 patients, and they enroll patients to get 2 different doses of tremiprosate, either 100 milligrams or 150 milligrams twice a day. Compare that to placebo. And the outcome measures was to look at ADAS-Cog score and also the CDR sum of boxes test score. And the study was 78 weeks, so that's about a year and a half. The secondary outcome looked at ADL and also global clinical status. And the result turned out to be that tremiprosate did not show any statistically significant benefits compared to placebo in slowing cognitive or functional decline. And also, the study did not demonstrate any clinical efficacy in mild to moderate Alzheimer's disease. This supplement actually has some CNS side effects, including dizziness, headache, and sleep disorder, and also decreased weight. Creatine. Creatine is a naturally occurring compound in our body that plays a key role in energy metabolism. So a small systematic review shows that creatine shows some modest improvement in short-term memory and maybe some reasoning abilities in healthy adults. However, the clinical significance in older adults or even patients with dementia still remains unclear. A smaller clinical trial shows that creatine did not improve cognitive function in healthy young adults. Side effects include dehydration, muscle cramps, water retention, renal problems, rhabdomyolysis, and also venous thrombosis. Magnesium L-threonate is promoted as the only magnesium product that supports brain health. It's a small study involving 80 participants, very young, 35 to 55 years of age, and the duration of the study was only 21 days. And that study concluded that magnesium L-threonate improves some sleep quality, but does that really have a direct translation to improving cognition? According to the Natural Medicine Database, magnesium L-threonate has insufficient evidence to rate its efficacy on cognition and also even on insomnia. Magnesium has a lot of diarrhea side effects, just like any other magnesium. So a lot of GI side effects, and it's very expensive too, almost $70. Ashwagandha, the study for ashwagandha enrolled 50 participants, age 65 to 80. These are healthy older adults. So they enroll patients who receive 600 milligrams of ashwagandha, compare that to placebo, and the duration of the study was 12 weeks. And the outcome was to look at quality of life, sleep quality, mental illness, and limitation. So there was some improvement in quality of life according to the quality of life score that they use. There was some improvement in sleep quality in the ashwagandha group, and also there's some improvement in mental alertness upon rising. So when waking up in the morning, uh, however, the study only involved 50 participants, 25 in each group, really limit the statistical power and also the generalization for the bigger patient population. One thing to know about ashwagandha, it has potential a lot of liver side effects, including acute hepatitis, acute liver failure, and also liver transplantation, and also death due to liver failure with the ashwagandha. Lion's mane comes from a mushroom, and the study for lion's mane involved 68 patients with mild to moderate Alzheimer's disease, and they gave the patient 3 capsules of lion's mane, compare that to placebo for 49 weeks, which is less than a year. And they looked at the MSC score and also at the instrumental ADL. And there was some improvement compared to the placebo group. The limitation of the study was that some outcomes were compared to the baseline instead of rather directly to placebo. So therefore, that can weaken the conclusions. In any study, if we measure changes over time within the same group, that does not account for other co-confounding factors um, uh, such as the natural progression of the disease or the placebo effect. So for better study, it's better to compare that to the placebo. And a lot of CGI side effects with lion's mane, including and also skin rash. Vitamin B12. The study involved 74 older patients with low B12 level. They gave the patient cobalamin for 1 year, compare that to placebo. In regard to cognition, there was no improvement in the MMSC score. However, all of these patients, their B12 level was normalized, so they have better improvement in other hematological markers such as hemoglobin. Um, so basically, the B12 study shows that even the B12 normal is level, but that still does not show there's an improvement in the MMSC score or cognition. A lot of times when we think giving vitamin B12, that can lower homocysteine level, and therefore it can help with cardiovascular problems. So in human clinical research, an IV loading dose of folic acid, B12, and B6, followed by oral B complex or B vitamins after coronary stenting, that actually increased restenosis rate. So we think it might help cardiovascular disease after stenting, but it actually did not. It actually increased the restenosis rate. B6, this study enrolled about 400 participants with mild to moderate Alzheimer's disease. They gave patients folate, B6, and B12. And what they found out was that the B vitamins significantly lowers the homocysteine level compared to placebo. But however, when they look at the ADAS-Cog score, there was no difference in the score between the B vitamin group and the placebo group. So showing that there's no difference in cognitive decline in the B vitamins group. And again, when they look at the other functional and global outcomes, there was no difference either in the secondary outcomes. High dose of vitamin B6 can also cause sensory neuropathy, especially at high dose, over 1,000 milligrams daily. Multivitamins. This is a bigger study, involved over 2,000 patients. They enroll patients to get daily vitamins, Centrum Silver. They compare that to placebo. They also compare that to cocoa extract. And in this study, it shows that is a statistically significant improvement in overall cognition compared to placebo, but in the co extract group, there was no benefit. So as of now, the Alzheimer's Association emphasizes that it is too early to recommend multivitamins for cognitive protection, pending further and bigger, larger clinical trials to determine that clinical effect. Vitamin E. This study enrolled patients with moderate to severe Alzheimer's disease. They enrolled patients to get either sertraline or high-dose vitamin E 2,000 units daily, or a combination of sertraline and vitamin E, compare that to placebo. And the outcomes was to look at the time to occurrence to one of the four outcomes. Either the patient died, or either the patient went to a facility, or either the patient lost basic ADL, or now the patient has severe dementia. So in the vitamin E group, the median time to the endpoint was more than placebo group, so showing some improvement. It takes more time for the vitamin E group to get one of those outcomes, either death, going to the facility, or loss of the ADL, or severe dementia. Sertraline group perform better than placebo, but not as well as the vitamin E group, and the combination group is not that much difference compared to the placebo. Looking at the MMSE and other dementia scale, there was no differences between the treatment group and the placebo group. So there are side effects of vitamin E. Some evidence suggests that taking vitamin E, especially greater than 400 units a day, and then also over one year, might increase the risk of mortality in non-healthy patients. A population study actually showed that using vitamin E is associated with significantly increased risk of mortality in people with history of severe cardiovascular disease, such as stroke or MI. So people who had stroke or MI, and if they take vitamin E, there seems to be increased risk of mortality in these patients. So despite a positive finding of vitamin E, the World Health Organization recommends against use of vitamin E for the management of dementia due to the risk of side effects. Next is ginkgo biloba. Ginkgo is thought to inhibit toxicity and cell death induced by beta amyloid. However, this has not yet to be demonstrated in vivo. The dosage is ranging from 60 to 240 milligrams daily. Side effects include GI side effects, also headache, dry mouth, and arrhythmia. The study for ginkgo biloba is the systematic review looking at 15 randomized clinical trials. The adults were enrolled, and those adults had Alzheimer's disease, vascular dementia, or mixed dementia, and these participants received ginkgo 120 milligrams up to 240 milligrams a day, and the duration of the study was 4 weeks up to 24 weeks because these are 15 clinical trials, so each trial had a different dosage and a different duration. They compared that to placebo. The outcome measures was to look at the MMSE score and also look at the SKT, which is another short cognitive performance test. The study also looked at neuropsychiatric symptoms by using MPI, and also look at the function by looking at the ADLs. The result turned out to be that 11 out of 15 randomized trials show significant improvement in cognition, behavior, function with ginkgo biloba. Only 4 clinical trials shows that there's no difference between the treatment group and the placebo group. Huperzine A is another one that you probably have heard about. Huperzine A was identified by scientists in China in the 1980s as a potent reversible inhibitor of acetylcholinease, which has a similar mechanism to donepezil, rifostigmine, and galantamine. However, the dose has to be taken in 2 or 3 doses a day. Side effects include blurred vision, diarrhea, insomnia, uh, and also bradycardia. So a lot of side effects are similar to donepezil. So the study for huperzine A involved patients with Alzheimer's disease. It is a systematic review and meta-analysis. For cognitive function, small clinical studies show that huperzine A improves cognition uh, as measured by the MMSE compared to the placebo. However, the result was inconsistent when they looked at the ADAS-Cog and other memory tests. For dementia and Alzheimer's disease, there was one clinical trial conducted in the US. Patients with mild to moderate Alzheimer's disease received 200 milligrams twice a day for at least 16 weeks, and that study did not improve any cognition based on the ADAS-Cog. However, the group that took higher dose, 400 micrograms twice a day, that shows modest benefit observed on the MMSE and also ADAS score. So a lot of these research were done in China, and currently huperzine A is an approved drug for Alzheimer's disease in China. Next is alpha GPC. There are two trials here. The first one is a clinical trial looking at patients with mild to moderate disease. They gave the patient GPC 3 times a day compared to placebo. They looked at ADAS score, MMSE, and ADL. And it looks like alpha GPC significantly improved the scores of MSE and also ADAS-Cog and also the CGI, and also there's some improvement in functional ability in the alpha GPC group compared to placebo. The other one is a meta-analysis looking at adults with adult onset cognitive dysfunction. They looked at either the patient received the GPC alone or GPC with donepezil, and it shows that there is significant improvement in cognitive function with the alpha GPC group, either used alone or used in combination with donepezil. And also there has been some improvements seen in ADL in this meta-analysis as well. Alpha GPC is thought to be a precursor to the neurotransmitter acetylcholine. Synthetic alpha GPC is available in the US as a dietary supplement, but in some European countries, it is a prescription drug. Side effects include GI side effects and also confusion, fainting, headache, and insomnia. One thing to note about alpha GPC is that alpha GPC use for at least 2 months has been associated with increased risk of stroke compared to non-user or compared to those who use alpha GPC for less than 2 months. Next is L-acetylcarnitine. They involve older patients with mild cognitive decline, giving the patient the L-acetylcarnitine, compare that to placebo. It shows that there's some improvement in cognition based on the MSC score, and also better memory test score based on the RAND memory tests that they performed in the study. There's some CNS side effects with this supplement, including agitation, confusion, aggression, insomnia, and also reduced appetite. Debenone is actually a synthetic, smaller analog of coenzyme Q10. This study enrolled patients with mild to moderate Alzheimer's disease. They gave the patient a debenone 3 times a day, and the result was done for 24 months, which is 2 years. They compare that to placebo, and the outcome shows that there's some dose-dependent improvement. So it is dose-related. There's some improvement according to the ADAS total score during the first year, and also efficacy continue over to the second year of treatment. Side effects include GI and also weight gain, tachycardia, and neutropenia. Currently, adiponone under the brand name Raxone is not currently available in the US. but it is available in some of the European countries. Phosphatidylserine, this study was a small study, involved 33 patients with mild Alzheimer's disease. The intervention group received the phosphatidylserine serum, 200 milligrams, 3 times a day for 8 weeks. Compare that to placebo. And the primary outcome shows that more patients improve on the clinical global impression score during the first treatment compared to placebo. However, the effect was not did not carry over. It was only transient, so it did not carry over to the after the first treatment phase. And then looking at the secondary outcome, there another scale that they use, the dementia scale, and there was no difference in that dementia scale. Side effects include allergy side effect and headache and insomnia. Saffron is a spice. So this is a systematic review and meta-analysis looking at saffron. Uh, 3 studies, 3 clinical studies compare saffron to placebo, looking at ADAS-Cog and MSE, and it shows that saffron improved cognition compared to placebo. 3 of the trials compared saffron to denatazil, and it shows there's no difference in regard to ADA score and MMSE. So that just shows there's no difference between saffron and denatazil. There was one study comparing saffron with memantine, and again, there's no difference between saffron and memantine in regard to ADAS-Cog score and MMSE. Side effect includes a decrease in platelets, white blood cells, red blood cells, and then bloody diarrhea, and also anxiety. So those are a lot of supplements that I just talked about. And as you can see, most of the supplements have insufficient reliable evidence to rate that would be effective for cognition, and this is based on the natural medicine database. So a lot of these supplements either have insufficient reliable evidence to rate, whether because it's a smaller study or because the results were inconsistent. And some of them, it shows that it is ineffective. But there are some that are possibly effective. For example, vitamin E, but World Health Organization still recommend against its use due to side effects. There's also other supplements that are possibly effective based on the natural medicine database, but I would still need, we all need to assess risk and benefits, especially the alpha GPC can increase risk of stroke, and also the the L-acetylcarnitine as well, due to liver problems. So to summarize, we want to go over the patient case. This patient is a new patient who came to the Sinai clinic to establish care. Her chief complaints were diarrhea, heartburn symptoms, feeling nauseated, losing appetite, not eating well, insomnia, feeling lightheaded at times, memory concerns. And the daughter reported that the patient may not be taking medication regularly because of her dementia. The problem list include diabetes, mild to moderate dementia, anxiety, and also osteoporosis. However, the patient was on alendronate, 70 milligrams weekly for 6 years, but then the patient stopped in 2024, so that was last year. All labs were normal, except for low B12. A1C was 6.4%. DEXA T-score shows osteopenia. Blood pressure is fine, a little bit low on the heart rate. And these are her supplements. So with that, I just want to open up to get feedback about the patient's supplements before we move on the next slide.
And feel free to unmute yourself and provide feedback, or if you'd prefer, just put it in the chat. looking at the list and, reviewing the wisdom that Trang shared, all the really important studies and findings. And Karen's like, is she actually taking all of these? It's a lot. It's costly, time consuming, potentially really not so good for her. So Karen asks, is she taking all of these?
She brought all the supplements in.
Yeah.
And when we asked, and then the patient said yes. Okay, we can go over to the next slide then. Okay, we're gonna go down one by one. Oh, I don't see the chat. Is anybody writing anything in the chat, Nancy?
I'll monitor it for you.
Okay,
Yeah, that's
okay,
the last question in
okay,
the chat. And
okay.
I'll keep an eye. Thank you. We can
Thank you.
do this together.
So patient's case. Okay, look at this first one. Prevision. We know that it's not effective, according to the study. Mectin, which is magnesium L-threonate, it can cause diarrhea, and the patient reported that the patient has diarrhea. Turmeric, it can cause GI side effects and nausea, and the patient did report feeling nauseated. Omega-3 can cause appetite suppression and nausea and diarrhea. So all these patients are symptoms that the patients are having. Creatine can cause dehydration because creatine can draw water into the muscles. This intracellular water shift can reduce the water available else in the body. So dehydration is a big problem in seniors. So it is important to really monitor for any medications that can cause dehydration. Coenzyme Q10 is not effective. Trimipramine, the study did not show efficacy. Nuriva can cause insomnia, and the patient has insomnia, and probably due to that the whole coffee fruit. Saffron, the patient's already taken the Napozil, and side effects include change in appetite and nausea, which is similar to the Napozil, and also saffron can cause anxiety, which is on the patient's problem list. Huperzine A has a similar mechanism of action and side effect as the Napozil. Tenofovir 10 milligrams daily. So because the patient is reporting having diarrhea, not eating well, so it's okay to taper the medication and then stop the medication and then monitor if the GI symptoms improve. Core calcium. So because the patient had osteoporosis before, the patient was on alendronate, and that kept it at osteopenia. So therefore, adequate of calcium is important. So therefore, the patient doesn't have to take core calcium because it costs a lot, $70 per month. So we may as well change to something that is cheaper, either calcium carbonate, which has a similar structure like core calcium, or we can even change it to calcium citrate. Vitamin D, 1,000 units daily. Patient has osteopenia, so it's important for the patient to have adequate calcium and vitamin D supplements. So I would say it's still okay to keep vitamin D for now. And vitamin and multivitamin, the patient is not eating well. If the patient is not eating well, so it is important for the patient to stay on multivitamin. So it's okay for the patient to keep the multivitamin. And earlier that there is some positive effect or outcomes for multivitamins, but then we're still waiting for the bigger clinical trials to confirm that. Metformin, 1,000 milligrams twice a day. Metformin can also cause GI side effect too. So as of now, we can keep it for now or we can reduce. But if we keep it for now, we would likely need to reduce the dose because the patient's A1C is already at 6.4. Um, so it's important to note that we want to change one medication at a time unless the patient is having side effects. And according to all the symptoms that the patients are reporting, the patient is having side effects because all these symptoms are associated to the supplements and medications. So when the patients have side effects, we can stop the medication. And when we start changing any medication, we want to monitor for any improvement in the GI symptoms or any worsening of dementia symptoms. Okay, so to talk about
Before we,
medications.
sorry, Trang, before we go on, I just will add, Emma wrote in the chat too that, she may not be the best historian, but it would be helpful to know if any of her symptoms highly correlated with initiation of donepezil or any of the supplements. Might be hard to know though. And yeah, do you want to? Thank you, Emma.
Yeah, I was just gonna say like a lot of my patients will tell me, "Oh, I have diarrhea, but I've had diarrhea for many years." And like I'll, try to elicit, "Well, did the diarrhea get worse when you started doing Episil?" And sometimes it's really difficult for them to answer, but
Mhm.
I don't know how long she's been on all of these supplements and there's
Mhm.
so, it'd be very difficult to figure out. But that is just something I pay attention to with donepezil and supplements. Like, do these symptoms start when you started this medication or this supplement?
Mhm.
Yeah, great point. Yes. When patients have symptoms, I usually ask, do you think that you have these symptoms before starting? Even before starting the Napazil or any of these medications, we don't know how long the patient has been on this medication because she is new to the clinic. Um, so uh, so then we go by side effects, and we go by like eliminating one at a time. And the patient may be not taking the medication regularly either. The doctor thinks so, but the patient said, I do take them. But she's not a good historian either. So yes, I do agree. I do agree that we can eliminate supplements. We can keep the Naproxen for now, or we can taper that and see and monitor. We can ask the doctor, since a patient is taking the Naproxen, is is her symptoms better? Um, and the daughter can help that as well. So I would say yes, is we can keep the Naproxen for now, but due to the side effect that the patient is having, we monitor to see if GI symptoms improve, or we can decide to keep it and just take off the medications that is that the patient is taking for memory and it's not helping with her memory. I hope that's answered your question.
Yes, thank you.
Yeah, we even have patients I had patients that had rash and this regarding to the warfarin, and the patient was on warfarin for years, and then she had rash, and she didn't know why, and then she did report that she had rash since she started warfarin, and we switched her over to DOAC, and the rash went away. So sometimes the symptoms can go back way more if we stop to ask. So yes, I appreciate your feedback. Okay, so when we talk about keeping our brain healthy, we don't just talk about medications. It's not about medications. It's important to do other non-pharmacological approach to keep our brain healthy by staying active, prevent and manage any other concurrent disease such as diabetes or blood pressure, prevent or correct hearing loss, try to avoid drinking alcohol and stop smoking, get enough sleep, reduce stress, and also very important to stay social. So with that, I want to thank you for your attention.
Thank you so much for this amazing talk. So much information. And I imagine there are questions. So maybe stop the share and we have some time. And Kelly says in the chat, thank you, very informative. Yeah.
Although I don't see a lot of patients on supplements as I used to, like maybe I want to say 15 years ago, there was a time that everybody is on supplement. I had patients who I walked in and I asked the patient, "Are you taking any medication?" And she snared at me. She said, "I'm not taking any medications." I saw 2 bags of grocery bags, paper bags, very big. And then she said, "But I'm taking supplements." And I went through all all supplements in those 2 bags, and a lot of them were duplications. One might say this is for bone health, and the other one say this is for brain health. And when you look at the ingredients, pretty much a lot of it are the same. So it's very hard to stop supplements if they've been taking so many. And and so I so what I do is I identify duplications, and I usually ask, are you interested in taking less supplements or less medications? And I said, I believe less is more. And most patients say, yeah, I only want to take what I need to take. Um, so we just went through drug duplication, and what I find is that medications that cause problems with drowsiness, dizziness, sedation, increased risk of falls, they are very afraid of that. And they are willing to stop the supplements or even prescription drugs, even Valium. They agree to, if they don't agree to stop, they most of the time they agree to taper it down. So I find that it works well. It works well when we kind of address what their concerns are. So they agree to stop or to lower the medications.
Great. One of the things I encounter in the clinic from time to time is somebody who's on Coumadin or a DOAC, and they're on ginkgo or they're taking fish oil, both of which can increase the bleeding risk. So that, we have that conversation. Do you encounter that? Has anyone else some people are nodding. Yeah.
Yeah, even garlic. When you're on garlic and you go in for surgery, you got to stop garlic like a week before because it affects the platelets. So therefore, yeah, patients need to know that as well. Not just warfarin, is DOAC, and also they go in for any type of for procedure or surgery. That increases the risk of bleeding.
And yeah, Brock said it went down, but it's kind of creeping up against. And I've definitely had those patients with the bags of many costly supplements. Devin, do you want to unmute yourself and share, or?
Yes, can you hear me?
Yeah, we hear you really well.
Hi, so I'm Devin, a new geriatric fellow at Swedish Hospital. Thanks for this interesting talk. I just put a couple links in the chat regarding supplements that I've found over the years to be helpful. Curious if anyone had other places they go to when they encounter something they're not too familiar with in a patient's large paper bag or supplement list.
I also find that natural medicine database is very useful as well. And in there, it has links that leads you directly to the trials of the study. So I find that is useful as well. And then it rates, what is possibly effective, possibly ineffective, or not enough evidence to rate. And I agree about the G. There's ginger, ginkgo, ginseng, garlic, and glucosamine. I usually tell patients the five Gs, the five Gs. So ginkgo, garlic, ginger can increase bleeding and increase the INR if the patient's on warfarin. Ginseng is actually the opposite, decrease the INR. And then glucosamine, there's some mixed data about increasing the INR. But I think that is more, it has more of indirect side effects. So if the patient feels that they take glucosamine and they feel that they move better, um, usually it takes about 3 months for glucosamine to be fully effective. And then after 3 or 4 months, they feel better. They are more active, and their INR drop. And it could be an indirect relationship instead of direct relationship between glucosamine and warfarin.
I've noticed an increased consumption of creatine, and my patients have been messaging me a lot about that and asking me, and I didn't realize the dehydration piece, so that's really important.
And muscle cramps
Wow.
too. Yeah, and also rhabdo can also occur as well. Yeah, yeah, yeah.
Yes.
It's more effective, more data showing that it's more effective in athletic performance rather than cognitive performance. So I'm interested in find out if patients come in and like almost very uh insist that that supplements are natural and they're not drugs. What do you tell them? I hear that all the time. These are natural. They're not drugs.
I usually tell them, they have side effects just like drugs. And, it may seem more natural, but like everything is made from, a specific part of our earth, and you just add these additives to it. It makes it a drug. But they can affect you just like drugs can.
Yeah, exactly.
And I think when you go over the side effects with them, because a lot of, they're scared of side effects. So if you tell them like this supplement can cause dizziness, then that'll instill some level of fear of, okay, then I don't want to take it because we don't have proof it's helping me either, if you balance the pros and cons.
Right, right.
The
I use
other
them.
thing, oh,
Yeah.
sorry.
Oh, yeah, go ahead, Nancy.
I was just going to say the other thing that I encounter in the office, and I think you demonstrated really well how it can worsen the harm, is some people will say it's natural, so it can't hurt. And if a little's good for you, then a lot's better. And so, for example, I've encountered neuropathy with pyridoxine toxicity, with the B6 toxicity
Mhm,
in probably a handful of patients
mhm.
because they were just taking a really high dose of a B complex. And so just having that, how do you have that conversation? I'm curious with people. Because the creatine dose, to Emma's point, that people are recommending, that the people are now starting to take from like a study of 20 people where it wasn't even um, significant. I mean, we can't say from a very small study anyway, but like it's very high dose, right? Compared to
Mhm, mhm.
the athletic benefits, which are established for, um, muscle building, but not for brain health, certainly. Brock?
Yeah, like the main thing that I say, I try to keep it really, really simple. And I say that one of the hardest things that happens as people start to lose their ability to think and organize is taking medications, and that it is so easy to lose track of what you took or what you didn't take and take too much or take too little, and
Mhm.
that the most important way that we can sort of get around that or sort of reduce that problem is by keeping the number of pills that you take really, really small. And it's really important for us to try to narrow down to what are the pills that are really, really important that you always take and that you never miss. And that it's going to be so much easier to do that if we reduce the number of pills you're taking. And so these are the pills that I absolutely think you for sure never make sure you miss them and never make sure you take them twice by accident. And these other pills, I'm worried that they could be causing side effects, and I'm worried that they could be making all of your pill taking so much more complicated that you're going to miss the ones that you so really, really importantly need.
Yeah, the other vitamin that I sort of look out for too is vitamin D. I've had a couple people vitamin D toxic, and I feel like it sneaks into a lot of those, brain healthy. So it's just like, yeah, like you said, trying looking at all the ingredients and making sure there's not a lot of duplication, especially if they're already being prescribed vitamin D. You don't want to go any higher.
Yeah, that's great. Yeah, usually patients in the past said these are natural. They natural. They're not prescription. They're not drugs. So what I usually I tell them, I said mushrooms are natural, but not all mushrooms are safe. Some mushrooms are poisonous. And then they said, oh, so I said same thing with supplements. They all have side effects. And I usually ask upfront, are you interested in taking less medications? If you are, I can help you to go through all these medications and to help you just to figure out what you really need to take. Um, and then they agree. Mo the only times that they are not on board is if are seeing a naturopath, and the naturopath is telling them that they need all these supplements, and then we on this side try to go over the side effects and the study, and that's when I feel that they're not completely on board, but most of the time patients are on board. I had a patient who he has dementia, and his wife was taking him to see a naturopath. Patient was on warfarin, and his iron was all overboard, never in range, never in range. The wife like looked at me and say, "Help me." Call the naturopath. The naturopath told me I have to take all these supplements, and I counted them. There was 21 of them, and a lot of them included vitamin E, vitamin K, lots of duplications. And then I said, yeah, I will call the naturopath. And I called the naturopath, and I didn't think that the naturopath knew the patient was taking 21 supplements. I thought that the wife was just going to buy on her own, but some of them she bought it from naturopath, and she said it's getting too expensive. Can you call the naturopath for me? So I called, and I said, well, what the wife asked me to call because cyanide is all over the board. He's actually taking 21 supplements, and I was told that he should be on 21 supplements, and I think that was hard. I think that was hard. The patients ask us to help. Patient has conflicting information from different health professionals. So I think that's harder. I think it's then by that point we need to talk about the expectations of the disease, right? Um, will the disease gonna progress? Whether the patient's gonna take the supplements or not. So I think the patient I felt the patient did not have a realistic expectation of the disease progression. Um, and the family was desperate, bringing patients here and there, buying this and that, hoping that it will work.
Yeah, I'd also like to add, this is Karen, the care partner representative on Echo Dementia. And I think we should mention before we close here, just the power of advertising. And, we see these just bombarded for some of these Nariva and Prevagen and so forth on all these channels, and they don't spend money on advertising if it doesn't work. And I always notice, I have my doctorate in nursing, so I'm familiar with reading the literature and how to report literature accurately. And they say things like clinically studied or several clinical research studies, and they don't say that it worked. They just say it's been clinically studied, and then they move on with their advertising. And the lay public doesn't know how to interpret that. To them, that sounds really legitimate, that it's been clinically studied, and they wouldn't be advertising it if it didn't work, right? And so I think part of the education is maybe bursting the bubble of naivete a little bit of being susceptible. And like you said, when my husband had dementia, I said, we're kitchen sinking this thing. And we took all kinds of supplements and because you're feeling desperate, and allopathic medicine doesn't have a cure. And so it's one thing, I think, for healthcare providers, nurse practitioners, and physicians and so forth to say, oh, the advertising or so forth is not really. But if people like me and other people who try to be educated consumers can talk about this in our support groups, because it comes up all the time, and people start feeding on that. Oh, we're taking this. Oh, we're going to add that and this, and that often there's no critique. Like, oh, the advertisement said clinically studied, but did it say what the results of the studies were? Or did they talk too fast about all the side effects when they go blah, 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 blah. All these things can happen, liver damage, death, da, da, da. To catch all that. So I think as much as we or as you can support people who are doing peer support or, non-clinic room workshops and programs and so forth, just kind of weave that into conversations, just so we can all elevate our medical literacy or herbal literacy, I'll say,
Thank you.
about this topic.
Yeah. Thank you so much. Thank you for sharing that. It's so important. And it's really hard when you have that very aggressive direct to consumer advertising, making all these, promises. So can people see, please bring forth case presentations. And I want to thank again Dr. Trang Lee for that amazing presentation, which we'll share out. Just as a reminder, if you are part of University of Washington, then just text 13461 to this number after you've registered. And if not, Zoom Analytics and Sarah can track and provide CME. And our next topic, didactic, is on genetic testing in dementias by Rachel Westman on the 26th. And then October 10th is a panel talking about blood-based biomarkers. Thank you all, and we will see everyone in a couple weeks. And thanks again, Trang.
Thank you.
Bye. Please complete the survey if you can. It's in the chat. Takes less than a minute.